So, good morning, namaste, and welcome to the third day of Metabolic Health Conference from India. And this is the final day after 2 days, two marathon days of the conference. Today, we have a very special guest with us, Dr. Salih Saad Al Ansari, who is an assistant professor of family and community medicine and CEO, Health Promotion Center, Riyadh, Saudi Arabia. He was the Director General of School Health, Ministry of Education for 10 years. He was appointed at critical positions in the academia, and he has been an advocate of health promotion and combating non communicable diseases in the Arab Gulf state and Saudi Arabia since more than 28 years now. He has written two books in Arabic on walking and translated more than 200 articles on walking, nutrition, health promotion, and NCD. So we'll welcome Dr. Ansari. And also with me is Shashikant Iyengar. Anup will be joining in a bit. Shashi and Anup are the co-organizers of India's second Metabolic Health Conference titled Metabolic Therapies. Welcome, Shashi.
Yeah, uh, Dr. Ansari is yet to check in. So meanwhile, Anup, get Anup in. Yeah,
Yeah, good morning.
good
Good morning,
morning. So I
everyone
think
watching.
Good morning.
good morning to all. And I think we had a very exciting session in the last 2 days covering the metabolic ketogenic therapies in mental health disease, even the neurology space, of course, and more will be covered today. We had sessions on cancer and even CKD, chronic kidney disease. See, generally in India, people think that when it comes to ketogenic diet, it means it is going to damage the kidney. So that is the immediate perception. Whereas we have seen actually two specialists coming and speaking. One was a nephrologist who is applying low carb nutrition, maybe not ketogenic, but low carb nutrition is patient to correct a lot of metabolic syndrome. We also had Professor Thomas Oimbis from Santa Barbara, who has actually done researches studies on how ketogenic diet can actually be applied to a condition called polycystic kidney disease, which doesn't have a very strong, very good prognosis. So people will end up with complete failure. They'll have to go in for transplant. But however, he found out through research, whether it is mouse model or for retrospective population study or specific studies, then they are also going to conduct studies ahead. And they have found extremely encouraging results in terms of stopping the progression or even possibly reversing it also. So a lot of prospective studies will now be conducted, but the lot of excitement appears to be in this space. We have had Dr. Georgie Ide coming in, Dr. Rachel Brown coming in, and Nicole also coming in, who's a licensed healthcare practitioner, and how they have very successfully applied the spectrum of low carb or ketogenic diet, or let us say even carnivore approach for the matter, to reverse some of those people think that, I mean, the common knowledge is psychiatric condition like bipolar or schizoaffective disorders may not be reversible, or they are consigned to a lifelong medication. So they have shown that by applying ketogenic diet, they're able to reduce the medication. Some are able to come off it, but nevertheless, there's a great resolution in symptoms. People are able to get back to normal life also. So it's really a very encouraging thing which we are seeing. And also in the cancers, we had Professor Seyfried, Dr. Nasha coming in. So their concept on the metabolic approach to cancer, rather than the genetic approach, more of the metabolic approach to cancer, has also thrown in a lot of information that we can when it comes to cancer, we can take care of the metabolic part. Their uncontrolled blood sugar, that some of them may be having weight issues. And what they have seen is by controlling these factors, the prognosis seems to be better. So the cancer patients are able to get, or they are able to withstand the conventional treatment like chemo or radiation in a much better manner compared to if they just go with the standard way. So while applying these dietary principles, they are able to have a very good success rate also. In fact, in many of the cases, some of the cases as expressed by Dr. Nasha herself, so she has brought her cancer into remission. She's a live example and doing a lot of work in this. And we had exciting talk with endocrinologists on diabetes. So we had Dr.
Mm,
David Kavan and Dr. Marila Gland, who are
mm,
qualified mainstream endocrinologists, who could come and tell us that this is the paradigm which they have suddenly learned,
mm.
and
Yes.
they have changed the practice from from the total medicine to now applying low carb nutrition. And they are using both the approach. Let us say that I'm not telling that they are totally into only prescribing dietary measures. No, they use medication also, but these medications are by far very less.
Mm,
But they're using very less medication. They're able to control, and they're able to get even 30 years of people with diabetes to a good level. So either reduce the medication, some are able to come off also. Of course, those success stories we have in DLF is totally different. But that is what we have seen coming from a qualified nephrologist, qualified diabetologist, qualified psychiatrist. So these things are going to be more encouraging for all of us. Yeah, Anu.
yes, certainly.
Yeah, you talked of, carnivore and kidney condition. Now, one case that needs to be highlighted is from Dr. Kishle, where a kidney transplant case with other complications like, as he mentioned, vaginal bleeding, anal bleeding, and all. So he took up that case on his diet, and I think he mentioned creatinine dropped from 1.8 to 1.1, and all the other
Mm,
complication side effects, like anal bleeding or whatever was there, that is all gone. So that is one point. And second point is that this mental disorder. I mean, we have one case which we always talk. He was on, I think, three or four antipsychotic drugs. So of that, three were gone, and one was the dose was reduced to, I think, 50% or maybe 25%. So yes, besides that, he had the other complications of these medications, like being overweight, being diabetic, and his spleen had issues. So all those things were gone. Yes, till the time he reported, it was all perfect and fine. And as you said, there is a dietary solution for all metabolic disorders as long as we keep our minds open and not, as Dr. Kishle said, that in education it is either infectious disease or non-infectious disease. Infectious ke liye they have antibiotics and all those pills, that is fine. But for non-infectious, they start going on genetic side and then how to control that through pills again. So this pill-centric approach needs a second thought, and that has to come from top-down, approach. But unfortunately, I don't think that is going to happen. So world over, as you see, it's a bottom-up approach with few doctors, yes, being large-hearted, or I would say, open-minded to accept that yes, they were wrong.
mm, mm. I think very critical points there. More such, I mean, it's a total, just to conclude what both of you said, it's a total shift in the perspective of how we have been looking at critical ailments like cancer or even mental health with regards to the nutritional aspect now. So it gives a lot of insight hearing these experts and doctors who themselves are practicing low carb on their patients along with the medicines. So I think.
I'll add
Uh,
one point here now.
yes.
This, mental disorder, I think nobody knows, or maybe only few know because I've never heard anyone talking of it.
Mm,
Dr. Richard Bernstein, before he became a doctor, he was an
mm,
engineer. And as an engineer, he had taken, I think, worst cases of bipolar or something.
mm,
And yeah, there is one case. And he had recruited doctors along with him
mm,
just to show that reducing blood sugar drastically, all those patients, all, I think I forget the number, maybe 5 or 10, all the patients improved on their whatever score, they evaluate. And that paper he wanted to publish.
mm,
Everybody, I think, refused. Then he took up medicine, and I think that paper again went to some Israeli journal or somewhere. So this bipolar plus versus, or metabolic, I mean, mental disorder versus blood sugar primarily is
mm,
not something very new because it had been done by Dr. Richard Bernstein. If anybody goes to his channel and, hunts through one of his videos, it is there. Thank you.
No, it is amazing, as Emmy also said yesterday. I mean, I really credit Emmy, for bringing the spotlight back on Alzheimer's, as I always say. And Emmy has talked about this in all of her videos, and a lot of her videos actually, that, when she started looking for research material or reading material while she was doing her thesis, she was completely shocked at the evidence that was there already of insulin resistance being a primary factor in triggering Alzheimer's later in life. So you already have symptoms manifested, symptoms going on from very early age, maybe 30s, 40s, which actually manifest later in life, and by which time it is a bit too late to completely reverse that. But yes, looking at insulin resistance and looking at parameters like diabetes does give an edge over, just treatments through pills. Shashi?
I think, see, the perspective of Amy, her research, especially on the amyloid plaques, okay,
Mm,
and then the metabolic part itself is quite, quite, quite groundbreaking for quite some time. See,
yes.
now the metabolic angle is being recognized just now, but then she has been doing it for quite some time. I think, I don't know. I think it is maybe 6, 7, 8 years or a decade. Anup may know better.
Mm,
And
mm,
you see the angle of even the perspective given by Angela Stanton on
yes.
on migraines. So it is in stark contrast to what we really think it is.
Mm,
So while there are no specific dietary advices, or a general dietary advice is usually given, you take fruits and vegetables. We actually seen that in in her initiative, especially her Facebook has millions or lakhs of people or hundreds and thousands of people. They are getting better better health, or overcoming all these migraine episodes and symptoms by
mm,
going to ketogenic diet and taking bit more electrolytes, especially the salt factor. So in
yes.
these cases, we have seen that salt is actually the friend and not the enemy, as usual, as it is usually so said. And then sugar is the enemy in those cases.
Yes, and so whatever is the enemy is being pushed really, and which is a sad state of affairs. I think these sessions are completely groundbreaking and brilliant sessions, and every person who's going through such issues, and most of the people, do have issues of migraine. At least I know 4, 5 of them, and I forwarded them the link, and then they've gained, immensely through our sessions. So
Oh,
really brilliant ones.
yeah, talking of migraine, no, we don't have many cases. We just have one case of Vivek Mishra,
Mm,
where it was all gone along with his diabetic medications, his weight coming down, and his migraine was all gone. He
mm,
shifted to low carb. We have a live case. We have his podcast also, so anybody can watch later on.
And
So
that's
we may not have the numbers, the big numbers, but we have specific cases of almost every except for cancer, I think, because Shashi is
mm,
handling one bipolar case, if I recall
yes,
correctly, right?
I
yes.
think DLife already has one case where we have shown success, Rajneesh.
Rajneesh, yeah. So we have cases. We have cases to prove that it works. Rest,
Actually, in DLife, we have been having a lot of such cases. If you see, practically every spectrum is there. There is at least one case. So diabetes and obesity is one thing, but if you really see, there have been cases of remission of a lot of other conditions also.
Mm.